Hi, everyone, and welcome to the October CCSP monthly call. We have a bunch of people getting on so far today, so we'll give just another moment for people to get connected and get on, and then we'll get started. But welcome and really excited to have you all here. It's been quite a while since we've had a CCSP monthly call. So if you do have a camera, would love for you all to turn it on today so we can see all your lovely faces. And while everyone's getting settled in, if you wouldn't mind putting in the chat your name, which clinic you're joining from, and what you're most excited for about fall this year. Would love to say hello to everyone. So I'm Elsa, program manager for CCSP, and I just had the opportunity to go apple picking for the first time when I was in New Jersey for a wedding this past weekend. So that was a really fun activity for fall that I'm excited for this year, and I would love to hear from all of you what you're most excited about for fall this year. So go ahead and put your name, which clinic system you're joining from, and what activity or what you're most excited about for fall this year. Welcome to the Valleywide team. Great to see so many of you on today. Seeing some of you from Pueblo, as well as down in Denver from our Bruno Caritas team, up north at Sunrise with Katie. So welcome everyone, and please go ahead and introduce yourself in the chat. And Andy is also on from the CCSP team today. She should be able to be on for about the first 30 minutes today. So really happy to have you all on. And I am recording this call if any of your fellow navigators were not able to join today, and I'll be sending out the link to everyone. So I'm going to go ahead and share my screen, and we'll get going for today.
Hey Elsa, it's Andy. Sorry, my audio wasn't working earlier.
No worries. Hi, Andy. Andy, anything you wanted to note before we launch into our agenda?
No, just thanks for almost 25 of you being on the phone today, and we're almost officially almost at the end of our first quarter in the fiscal year. So time is flying, but thanks a ton, everybody.
Thanks everyone. And saw some things about people being excited for the leaves, the changing colors, getting to wear fall clothes, it not being in the 90s every day, and baking and hanging out with family. So thanks so much for sharing, everyone. And go ahead and introduce yourself if you haven't already. As Andy just noted, our first quarter of the FY22 fiscal year just ended last week on September 30th. And so we will be submitting our first quarterly report to the CCPD team by the end of next week. So as a friendly reminder, please make sure you've submitted your evaluation reports for all months of the first quarter. So everything from July 1st to September 30th. Really need that information by October 11th, next Monday, for us to get it compiled for our quarterly reporting to CCPD and see how things are going for each of your clinics as you're relaunching screening efforts for the new year. As a reminder, when you're sending invoices as well, please submit those to Barbara and Kelly from the UCC finance team, as well as Andy and myself, having a CC just so we can make sure to track those. And then also we've just had a call with almost all of our clinic teams now for the launch of this year, but just as a friendly reminder, please use those barrier reduction funds. So submit your requests for transportation, bowel prep, translation, interpretation, hotels for patients that might not have a home to do prep in. So please submit your requests. We've sent the invoice form along, as well as your receipts to Andy and myself for review and processing. And then we pass those on to our finance team. We can reimburse your clinic system, but not the patient directly. So we really want to make sure all of those funds get used up and are going out into the communities. Also, just a couple other things that we have going on our side is we're hiring a program coordinator. And so that job is posted. Hope to have someone on soon that we can introduce to all of you to be supportive of all of the great training opportunities we have, other programming, and supporting all of you with patient navigation efforts and our capacity building efforts. So if you know anyone who you feel might be a good fit, I've linked to the application in here. And then additionally, I've been going through a big process to update our CCSP program guidebook program manual. It's been a while since it's gotten a refresh, so looking forward to having that to pass along to all of you in Q2, hopefully. So big refresh on all the information, the latest updates and guidelines, as well as the different components of navigation, and a big update to all of the different resources we have for you all out in the community for basic needs resources, different cancer treatment, and different other resources for those who receive a diagnosis and also need support with transportation during screening or during their diagnosis. So look for that soon. I'm really excited to have that updated. It's been quite a while since it's gotten a full refresh. Andy, anything else around fiscal or big program announcements before we go into some of the other things?
Nope, I think we're good.
Awesome. And then also wanted to let you all know that we do have continued funding to be able to support navigators who have not yet gone through the process to complete training through the Patient Navigator Training Collaborative and placement on the Colorado Health Navigator Registry. So if there's been new navigators added to your teams, right now we're in the process of getting folks connected to the Patient Navigator Training Collaborative for the level 1 training. So the training pathway for CCSP navigators, if you're newer to the program, is going through the Patient Navigator Training Collaborative level 1, which right now they're doing as an online course in Health Navigation Fundamentals. The next one starting October 20th. So registration is open now. And once folks complete that one, they go on to take the PNTC level 2 in care coordination, which there'll be one launching in winter or spring 2022 as well. And then for their online courses, they don't already have the motivational interviewing included, which they do for in-person of these trainings. And so that would be a separate online module as well. And then once navigators have all of those fundamental courses completed, the next step for CCSP is sitting for the Colorado Health Navigator Registry assessment. And so there's been about one of those happening a year for the last year or so. and going forward. And so since CCSP had a requirement to have at least one navigator on the registry from all CCSP clinics, we've met that requirement, but know that it's really important to have those foundations for new folks when they get added to the team. And we want to be able to support you all with getting that training. And we've gotten a lot of feedback from many of you who've already taken these courses that it's really valuable. And so if you have anyone interested in completing these courses, I know I've already gotten a couple clinics bringing up interest during our recent launch calls. So please reach out to me through email or even during the chat during this call today if you're interested in you or someone else from your team going through these trainings if they're newer to the team, and I can provide the registration promo code for the PNTC level 1, which the fall one is open now, but there'll also be one in the winter if the schedule is coming up too fast for the fall one. So really excited that we continue to have budget for these opportunities. And now I'm going to turn it over to Andy just to do a little recap and where we're at with our capacity building efforts for this year.
All right. So everyone, I know that we had a chance to share with you, of course, that CCSP will continue with the colorectal cancer screening navigation into colonoscopy in terms of really thinking about preventive screening and building capacity in general for the evidence-based screening initiatives. We're really continuing to work with CPED, WWC, thinking about opportunities for integration for breast and cervical and colorectal screening. But the areas that we're going to be working this year is really thinking about building capacity for stool-based testing. So I know that we visited with all of you about the opportunity that if you're interested in outreach, awareness, building any workflows, capacity, navigation, population management related to stool-based testing, we have many awards available for that work. And it's really thinking about how do you build, how do you move the needle in the work? And so if you're looking at how do you build a program, how do you staff a program, well, how do you message to patients? Those are all kinds of things that we consider in terms of capacity building. We also are doing similar type of approach for lung cancer screening. So if you're interested in assessments, looking at how your team can really ready yourself for looking at referrals for lung cancer screening, or how you can even build internal programs, as well as looking at genetic and family history assessment and really thinking about building in the capacity work for those referrals. We are going to be working with Ambry Genetics in terms of a telehealth chatbot and an opportunity for resources for genetic counseling and genetic testing that are going to be in kind to the clinics and CCSP. So if that's something that you're interested in engaging with us, you have a need for telehealth genetic counseling and capacity, that's something we can partner as well. So I know we've chatted with all of you one-on-one about these opportunities. We will be sending out more information about how to engage in the work and how we can help support you for capacity building around lung, stool-based testing for colorectal screening, as well as genetic and family history. Ambry Genetics, again, and the chatbot is something that we can work for integration into your system. We want to think a little bit about how to build that as an opportunity as we come. So we'll be having some more quasi infomercials about these opportunities. And Elsa has shared, I think, with most of you, the description of your strategies. So if you're interested in this work, we're asking for a little bit of information back in terms of understanding your strategy, what are your SMART goals, and then what are just some basic evaluation metrics in these areas. So keep those conversations going with your crew if this is something you're interested in. We have money to help support this work. And we will be offering, again, some additional opportunities to learn more about the IT and how you can really engage in the work moving ahead. But that's somewhat new in what we've done. I know UMC, Denver Health, a number of groups have, Brunner Caritas and others have done a lot of work around lung hereditary work. We're learning what we've learned from those experiences. We're helping build in the capacity assessment. But I just want to remind people that it's not just all or nothing. I mean, even if there's an area where you want to do some additional work, and even it's a low lift, just building the capacity in general, thinking about preventative screening is really what we're after. So nothing too big, nothing too small. We'd love to have your ideas coming our way. If we need to have some follow-up with all of you about next steps as it relates to capacity building, let us know. We'll hopefully be hosting a few things with Colorado Rural Health Center as well as CCHN to give medical directors and operating teams an idea of what these opportunities are as well. But we'd really love to really have all of you engaged so we can think about our next steps in terms of cancer prevention and integration. So Elsa, anything else you want me to share?
I think those are the big things. Thank you, Andy.
You're welcome.
And yeah, please follow up and let us know if you have any questions that arise as you're talking with your team. I did want to share a couple of the upcoming opportunities that are scheduled from CCSP and our partners. So the October monthly peer sharing call will be happening on Wednesday, October 20th at 11:30 a.m. And this month is focused on lung cancer screening. Since November is Lung Cancer Awareness Month. So these calls try to talk about the current landscape, benefits, and challenges ahead of the particular awareness month. So for October's call, with November right around the corner, we have Dr. Jamie Stutes from the University of Colorado Cancer Center, who's been a major leader in the field of lung cancer screening and making sure there's equitable approaches and reducing stigma. So he'll be joining for this moderated discussion. And if your clinic system is already doing work around lung cancer screening, or as we talked about on some of our calls, maybe interested in exploring how you get patients connected to lung cancer screening, I think this would be a great call for CCSP navigators to join. And I'll send out the links for registration. And then we have scheduled another rendition of the Interpreting Endoscopy and Pathology Reports webinar and training as a follow-up from the CCSP 101 that we had earlier this quarter. So on Tuesday, November 16th at 11:30 a.m., Dr. Jen Kolb, who has done this training in the past for us, will be returning to review some of those key components of looking at an endoscopy and pathology reports as you're helping navigate patients through screening, making sure that they understand the results they received from their provider, and also how you pull those key metrics that we incorporate into CCSP reporting from these reports. So I hope that you all will join us. I've linked the registration for that one as well. And Jen always does a really great job of really breaking it down into digestible pieces. For our November monthly call on Tuesday, November 2nd at 12 p.m., we will be joined by some guest presenters from the Colorado Cancer Coalition, including the CRC task force and perhaps a representative from the lung cancer task force, who will be talking about the different opportunities that they have going on, what the different task forces and the Cancer Coalition are currently focusing on now that the new cancer plan for the next few years has launched, and what are the opportunities for all of you to get involved, and how the task force can support your efforts in navigation and preventive screening, as well as opportunities for collaboration. So really thrilled that they have the time to join us for our next monthly call. And then the Colorado Cancer Coalition is also hosting a couple of symposiums in November. So the Colorado Cancer Coalition Symposium There's going to be a mini rendition that's virtual on Friday, November 5th, with the larger full symposium happening in the spring, so that we can hopefully all join that one in person. But for those of you who joined the coalition symposiums in the past, it's a great gathering of people from all over the state who are involved in work from every different aspect of the cancer continuum. So fellow navigators, as well as providers and others in public health. And Dr. Lisa Richardson from the CDC will be joining for this mini symposium, as well as a couple of other wonderful experts in the field. So hope that you would join for that if that's something you're interested in. And then for those who are doing work around lung cancer screening or interested in lung cancer screening, there's going to be the second annual Colorado Collaborative on Lung Cancer Screening, which is divided into 2 afternoons on Friday, November 5th and 12th. So lots happening this fall. Definitely don't have to go to everything, of course. All of these are optional, but wanted to make sure you all were aware of these opportunities and hope that you'll join for something that fits your interests and your availability. And I'm going to stop there before we launch into our getting some feedback from you all. What other programming you'd like to see from CCSP? But before we launch into our poll, I wanted to stop there and see if anyone has any questions or comments on all of the information we've shared so far in our announcements. I know that was a lot. So in the chat, or you're welcome to come off mute if you have any thoughts. All right, it looks like we're good for now. So I'm gonna keep grooving on. So we did want to hear from you all about the training or skills building topics you'd be most interested in participating this year or the next 2 years of the grant cycle, as we're planning out the remainder of our programming for the fall and for spring and going into summer of next year as well. So I've just launched a poll. So please select up to 5 different topics that you feel would be most beneficial for your clinic system or yourself for skills and information. We have bowel preparation, sustainability planning, so how we can continue to use the sustainability capacity assessment tools, compassion fatigue workshop hosted by the PNDC specific for navigators. You could host a workshop around navigating misinformation, including around vaccine hesitancy and other topics. Also a workshop around being culturally responsive to people from different cultures and backgrounds. We've hosted a couple of different motivational interviewing workshops in the past. And so there's the opportunity for more skills building around that with specific topics, as example, COVID, cancer, or a specific workshop for supervisors. A genetics 101 webinar, as we're doing more focus around genetics and genetic testing and counseling, genetic counseling and testing overview, process and resources. And then for lung cancer, a lung cancer screening 101, as well as this relates closely to lung cancer screening, but also other topics, shared decision making. So I'll give another minute or so for folks to take a look through the options and select up to 5 topics that you feel would be the most beneficial for webinar, workshops, training.
Also, if there are some things that aren't on here, should we just have people also write in the chat ideas that they have?
Yes. Please, yeah, please let us know what else we might have missed. Would love to hear some more comments about what else would be helpful, or if there's any other context as you make your selection. All right, I'll give it another minute or so. All right. It looks like we've got about everyone who's answered, so I'm going to go ahead and end the poll. And it looks like the topics that had the greatest interest at this point was navigating misinformation, compassion fatigue, as well as bowel preparation, and of course, many others that are right up behind there as well. So thank you very much. This is really helpful. I know that bowel preparation, compassion fatigue are at the top of our list as already with speakers that we could line up soon. So look for more information about all of these, and definitely feel free to type in the chat or let us know any other thoughts you might have of what would be helpful, as well as other outreach materials or other patient education materials that would be helpful. Andy, anything else around programming?
Also, I think just as you'd mentioned before, just a reminder that the navigator capacity, or excuse me, the navigator training and the opportunity to sit for the registry and the assessment is something that we can do. Ideas, if you need additional training or support or even outreach materials, we have those sort of resources available. So giving the feedback today is super helpful for us in the planning. But if there are topics that come up throughout the remainder of the year that you'd like us to find subject matter experts or to delve into further, that's something that's super helpful. And I do know that, of course, with our CCSP 101 several weeks back, that also really helped lead out the discussion around the pathology and endoscopy report was something that you all had noted as an area that needed some additional help. So that is coming up. Register for it, as you saw from the list, but we do try to be as responsive as much as we can. If you're interested, I think for some of the larger sites, if you're interested in certain types of training as we go forward, even at your facility, if we have the resources and time for that, we can definitely look into it with PNTC and other partners. If you even need something just specific for your institution, we can try to be amenable to that over the next couple of years. But thanks so much today. I have to run to another meeting, but Elsa, is there anything else you want me to cover today?
Thanks, Andy. I think we're good on all of those things for today. So thanks so much for your time.
All right, awesome, everybody. And thanks a million. And we'll all talk to you soon and have a great rest of the meeting. Thank you, Elsa.
Thank you. All right. So for the remainder of our time today, we wanted to have an opportunity for some discussion today, make this a little bit more interactive and provide the opportunity for each of you to share lessons learned among each of your clinics, around with keeping in mind that right now is Breast Cancer Awareness Month for October. And many of our clinic systems, of course, have their navigation processes and workflows set up, integrating different screening navigation so that clinics and patients are getting whole person care, not just navigating for one particular body part at a time if people are eligible for multiple screenings. So I have up on the slide the current discussion questions, and I'll launch this conversation, but we can really take it where it leads with what comes up in the conversation. So would love to hear from some of you about what your clinic systems are doing this month for breast cancer awareness, and when doing awareness and navigating folks into breast cancer screening through WWC CPED, if you're participating in that, at that time, are you integrating navigation services for patients for breast, cervical, colorectal screening, as well as perhaps other clinical services, diabetes management, et cetera? So what strategies have you found effective for delivering holistic preventive care? So feel free to either type in the chat or come off mute, but I'm gonna stop talking for a few moments to let someone start us off.
This is Laura here at Valleywide. We do a couple of different things. We huddle every morning using a huddle report on Azara. We use Azara, which will indicate any registries that the patient is on. And if we see that they're in need of a well woman exam, we'll address that during the huddle in the morning. We also have our financial eligibility specialists when enrolling individuals on the sliding fee discount programs. They will refer to the case manager in that clinic if they know that a woman has not received any well woman exam in a while, or if they're due. Some of the barriers that we've experienced, I mean, we'll give this information to the providers, to the nurses and the front desk staff. Sometimes the nurses are just too busy to make sure that the patient gets to us. And sometimes the patient says, yeah, sure, I'll enroll. And then before we know it, they're just kind of out the door. But we do follow up with the phone call or try to reach out to them and hopefully get them enrolled. We do, we do both WWC and CCSP.
Thanks, Laura. Marillac, Sunrise, other clinics that are on the call. Is this a similar approach to what you take? Are there other strategies that have worked well for you all in addition to huddle reports, Azara? What has worked well for awareness and navigation into breast cancer and other screenings together?
Hi, this is Carla, Maryland Health.
Hi, Carla.
Hi. So like Hollywood is doing, we're doing the same thing. We do the previous planning every night and just make sure that any patient that needs a colonoscopy or a PAP or mammogram is being alert in our system. The way we do the paperwork or eligibility is that once we alert front desk when the patient comes into the clinic, and we give them the paperwork and we discuss this for the patient if needed. The providers are sending orders as they have an appointment with the patient. They discuss if there's a moment, like sometimes it can get a little bit complicated in the way that the patient has chronic care. But if it is able, they're going to order mammograms. The other thing, Sarah, you can run a report in Sarah and it tells you which days your patients are coming, like future appointments. So for WWC, what we have done is we have some postcards. And this is something that we just start trying, and we'll see what it will, if it will be effective. So we're sending those postcards before they come in. If we know that they're going to be in our clinic in the next 2 or 3 weeks, that this is something new we're trying, and we'll see what happened with that. I think we have patients that already have it. I have seen a couple of patients that already had well women appointments scheduled, so I'm happy about that one. So we do the both CCSP and WWC.
Great, thanks for sharing, Carla. Others Cindy from UMC. Others, are you also doing any postcards or different mailings for awareness this month for breast cancer awareness? Or are you all, any of you, using social media? What methods have worked best for awareness for breast cancer, I'm saying, since it's Breast Cancer Awareness Month, or for colorectal as well?
This is
And for
Katie
those-
from Sunrise.
Yeah.
We've started sending out care messages. We didn't used to have that system, but now we have a care messaging like kind of text system that we can use. So we've had somebody sending out messages to women who are just due for their annual mammograms and letting them know how they can like get those scheduled. I'm also the navigator for WWC at our clinic. So we, help them get set up with that resource if that's something that's needed, or other resources in the area if they don't qualify for that program. So I guess that's not something necessarily that we're just doing in October, but that is something we do, and we also utilize those like Azaro reports and things like that too.
That's great. We're definitely hearing more about text messaging being a tool that can be used. So it's great to hear. I know Valleywide has mentioned they've also recently gotten a text messaging service as well.
This is Cindy at UMC. Can you hear me?
Yes. Hi, Cindy.
Hi. So I'm getting hoarse, so sorry about that. But we are doing mail outs. We have a web site page that we kind of blow up and send all over. And we decorate our office with all kinds of awareness and signs and posters in every room along with that. And then our outreach person goes Telluride, Nucla, Natarita, Norwood, all our surrounding areas, and just hands out all kinds of awareness goodie bags and talks to people and schedules.
Great. Cindy, have you seen an uptick in the past from those type of strategies after they're going out to those different places and events doing outreach? Have you seen that result in people actually following through with getting screened? How well do you think that's working, or what are some of the challenges and what are some of the successes with that?
The biggest challenge was COVID. The biggest successes are finding new patients and making them aware that they are due. And we do find that we have a lot more come in for annuals, call and ask about the mammograms, where they can go. We get them scheduled. We send them with gas cards because our nearest place is an hour and a half, 50, 60 miles one way. So once they find out that we help them with all those, we end up with a lot of new patients, but a lot of other people going, oh, it's been a couple of years for me. So I think it does a lot of good.
Thanks for sharing. Anyone else have similar experiences or other challenges you've been facing with doing outreach in this continued time of COVID? And what resources have you not been able to find, or what resources would be helpful to help supplement what you already have for awareness and reaching patients for in-reach and outreach? Anyone from our Pueblo team on the phone, or I see Southern Colorado Family Medicine is on, as well as Peak Vista. Are there any educational materials that you all have seen that you find work really well with patients, that they find really easy to understand or really help catch the eye? I know our different clinic systems, we've gotten a lot of people wanting to find out what others are doing that works really well. So would love to hear if there's a particular resource that you found really effective, and maybe we can share it out with everyone.
This is Cecilia from Tepeyac. Probably the most educational that had helped us during COVID and beside now is the post that we usually do have on our Facebook page. And we also facilitate small talks about breast cancer prevention. We had planned for this month with the Mexican consulate to have to facilitate a class live on the website of the Mexican consulate. But if anybody have any ideas or handouts, new handouts or something, please let us know.
Thanks, Cecilia. Yeah, it can be sometimes work really well to have partnership with particular community organizations or entities, yeah, such as consulates for different countries. So that's a great idea. All right. My last question is there anything else that, in addition to materials, are there different pieces of information or different linkages with WWC, CPED, and other programs and community organizations? What support would be helpful to be facilitated by CCSP and maybe some of the partner organizations to help further support your integration of providing whole person navigation in the preventive cancer screening? So breast, cervical, colorectal, lung. And if there's not anything in particular, I'll just open it up to any other closing thoughts of any of these different components of breast cancer awareness navigation, as well as screening navigation and integration of different screening services linking to patients. Anything else that you all would like to share as lessons learned for fellow clinic systems as we're launching into a big time of year for the different screening months? Awareness. I'll just share that American Cancer Society recently launched a campaign focused on return to screening overall. And so really trying to make sure folks go get the cancer screenings they're due for, but can be open to be tailored to specific screening types, and is more general of return to screening overall. So I can then definitely share links to those resources. As we know, COVID has continued to have an impact on delivering clinical care. So I'll also can link to the toolkits from the National Navigation Roundtable for a colorectal cancer roundtable, as well as American Cancer Society for return to screening. But if you all see any materials or videos, print materials, postcards, etc., that have worked really well, would love to share those out with everyone. So please send them my way, and I'll continue to provide you all with resources as well as we find out about them. I just shared in the recent CCSP newsletter that Hip Hop Public Health and Stand Up to Cancer recently launched a PSA or 2 PSA short videos with some hip hop stars. So there's one in English and one in Spanish about colorectal cancer screening and the importance of getting screened. But those are very catchy songs, short music videos, and very educational as well. So I'll share out those links one more time as well. But those are available for anyone to use. And then Carla just put in the chat that there's been a beaded necklace that they all have for one-on-one educational for breast exams, self-examination. So Carla, I don't know if you want to share a little bit more about that resource, come off mute, but that sounds really interesting.
Hi, so we did an outreach this past Saturday for, it's called the Convoy of Hope. And we joined forces with St. Mary's mammography. And one of the things that I brought to the expo was a beaded necklace. It is really, really interesting. It's a necklace, but it gives you the sizes of a lump that you will be able to find. And I was able to use it with younger girls that normally would not do it, but they had a lot of questions, which I thought it was very interesting. I had like maybe 3 or 4 20 years old kids that they wanted to know because their mothers had breast cancer. So I used that, and I think it was really, really interesting for them. To learn how to identify a lump in their breast. Actually, when we do have those breasts that you can take, and we have those too. But when you are in public, this kind of looks kind of funny for me because there were kids and stuff like that, so I couldn't take it out. I felt like it was not. I wanted to be respectful to the parents. So I used this necklace, and I think it was very, very well received by anybody that I used to use it with. And I also shared this with mammography, and they were really interested. So they thought it was a great tool to use in one-on-one.
Thanks for sharing, Carla. Yeah, that's a really innovative approach. I haven't heard about those necklaces before, and that could work really well, I think, in a fair, like, or public setting. So yeah, that's a great idea. If you have any pictures of that you'd like to share, I can definitely share them around with the group.
Okay, I'll try to find one.
Thank you. Any final thoughts from anyone else before we close for the day? All right. Well, thank you all so much for your time. So wonderful to have so many people on after we had a couple months hiatus from the monthly calls. I hope this discussion was helpful as you're continuing through Breast Cancer Awareness Month with Lung Cancer Awareness Month right around the corner. I see Carla did just link in the chat the link to that necklace. So if any of you are interested in that type of resource, please check that out, and I'll share along some of the other resources we've seen. And please let us know if there's anything else we can do to support all of your efforts. Thank you so much for everything and all of your hard work with delivering screening and getting your patients through screening. So thank you for all that you do, and I hope you have a great rest of your afternoon and week. Take care, everyone. Bye-bye.